Welcome to our new VETflix and Skillz series, where we hit on some of the key points of our webinars and our real life rounds for the past few months. We know that life is busy, and with so much information coming at us all the time, it's impossible to carve out some time for all these really amazing educational segments. So we hope that these tidbits might help hit some of the highlights. Without further ado, my name is Dr. Amy Kaplan. I'm a boarded small animal criticalist, and with me is Amanda Shelby, RVT and VTS in anesthesia and analgesia. So Amanda, let's start things off with a February 26th technician webinar on dental oral pathology, Find It and Fix It by Stephanie Perry, who's a CVT and a VTS in dentistry. Now, I know you moderated this webinar, so how about you go ahead and kick off our first VETflix and Skillz review?
Yeah, so this was from February of 2025. Super cool webinar. You know, dentistry is not my favorite. I'll be honest. As a VTS in anesthesia and analgesia, I definitely anesthetize a lot of dental patients, but I've always been on that end, not, tag teaming it. And Stephanie walks you through how important of a role the veterinary technician has, really a superstar for dentistry, right? So you're involved from the get-go all the way to the discharge on making a pet healthy in the dental realm. So every stage of life. And she really breaks down the importance of starting those evaluations in the conscious patient at every physical exam and every milestone exam. And looking beyond just the teeth, facial symmetry, soft tissues, lymph nodes, etc. Of course, then she walks through anesthesia periods, so induction and looking at all the inside of the mouth that perhaps you can evaluate as well. And it's just a really thorough review of literally tip of the nose to even behind the ear of everything that could be involved with that teeth. And what I really like that she highlights, and we probably need to practice this even beyond the dental suite, is the use of abbreviations for medical charting specifically. She does detail how to medical chart, which is really fascinating for dentistry in that webinar, so definitely want to take a look at that. But she talks about the importance of describing your abbreviation somewhere in that chart, because not everything translates from clinic to clinic, practice to practice, person to person, and we don't want there to be any confusion about what you're finding in that patient's chart in that medical record. So for me, that was the key takeaways. I think the clinical pearl takeaway for those doing dentistries is getting a full 360 view while minimizing movement, so moving the endotracheal tube and the monitoring equipment. And she mentions that you should try to do your dentals and dorsal to achieve that. So that's fascinating. Yeah. Maybe
Yeah,
up
and that helps
next.
to not move that endotracheal tube, right? So if you can
Yeah.
just keep your head in one position while you're doing that whole view, I thought you'd like that part.
Yeah, well, of course, as a nest. I'm like, yeah, because that's when tracheal tears and just, harm to the trachea could occur, and then obviously introducing fluid to the mouth. And yeah, so I really liked that. Again, I don't have a lot of experience actually cleaning the teeth, but as an anesthetist, not having to flip and flop and, use the endotracheal tube as a lever to hold the mouth open. I really like that tidbit of clinical knowledge that she shared. But yeah.
Mhm.
Yeah. So yeah, definitely check it out. Another webinar that I thought was fascinating in February of 2025, it was a small animal webinar. Again, not necessarily my wheelhouse, but I'm hoping you can give us some highlights about it, was the pathogenesis of atopic dermatitis by Dr. Sarah Ramos.
Yeah, absolutely. I mean, I'm not a dermatologist. Dr. Sarah Ramos is, thank goodness, but we definitely see a lot of itchy skin in the ER, so I can certainly talk about this one. And in general, there's a lot of derm education out there because let's face it, itchy dogs and cats, they make up a huge portion of the vet population. But so in this webinar, Dr. Ramos discussed atopic dermatitis, and she described it as a multifactorial inflammatory syndrome, and also just mentioned, it can be super frustrating condition for everybody involved, the pet, the owners, the vet staff. But one of the highlights that I particularly appreciated from this lecture is her description of the feline atopic dermatitis, because it doesn't look the same as canine atopic dermatitis. Now, my own cat suffered for years with eosinophilic granuloma complex, with this intense pruritus of her head and her neck. And I mean, I'm talking to the level of I had to put her in a full-on bodysuit, tried so many different e-collars, sedating medications just to get her to stop that itch, and calm down the skin. So it was just really nice to see cats getting some representation here because, we all know cats aren't small dogs. So we've got to be aware of their differences. And to piggyback on this webinar, there was another one in March of 2025 by Dr. Joya Griffin, who's also a boarded veterinary dermatologist. And she presented on a similar topic. It was called The Practical Approach to the Atopic Pet. Both doctors mention that allergen-specific immunotherapy is really the gold standard treatment for this condition. And it can be administered either injectably or transdermally, which I didn't know. Dr. Griffin also touches on our antimicrobial selection or our thought process of what we're going to grab for these flare-ups, because I know that I'm very guilty of reaching for medications that are given perhaps fewer times of day to help with some owner compliance, and maybe I shouldn't be doing that. But I don't have the benefit of building this rapport with clients to know whether or not they're going to have great compliance. But so basically, I might happily grab something like cefpodoxime because you're generally using that to treat staph infections, which is a skin commensal, and it's a once a day. So that might be something that I grab. But Dr. Griffin actually would probably slap my hand for doing that and tell me not to, because she was absolutely right in saying that it shouldn't be seen as a first line antimicrobial treatment. And we really all should be practicing good antibiotic stewardship and respect our order of our first line versus second line antibiotics, and probably just not reach for that drug unless we have a culture and sensitivity that's telling us to do so. But so now switching gears, let's move over to some of our practice management webinars. So Amanda, I'll let you pick the next one.
Sure, that antimicrobial stewardship sounds like you just talked yourself into another VETgirl blog, Dr. Kaplan. But yeah, switching gears, keeping the pace here, practice management. We had some excellent practice management webinars this past quarter. I think, we could all benefit, vet guys and vet girl listeners can benefit from listening to our leadership, practice management, and wellness webinars that we launch every month. And many of them are CVPM qualified as well as RACE approved for continuing education purposes. So we had one with someone I've really enjoyed learning from, Mr. Randy Hall. That was in March of 2025. It reviewed the performance review process and really kind of highlighted how we can do better to make performance reviews truly impactful for the practice, the hospital, as well as the individual. And I think that's really important. He highlighted really focusing on growth more than judgment, really by defining what success looks like. And then, of course, this isn't a once a year thing. We need to be doing regular feedback throughout the year, and avoid assumptions. So for me, that was the real highlights from his webinar from March of 2025. And then,
Yeah, I'm going to step in for just a quick
yeah.
second. Know that I personally dread these performance reviews, and I just loved how Randy Hall really made it. He made it less of this like doom and gloom, heading into a performance review. That's not how these are supposed to be. It is supposed to be more of that touching base with your employee and employer and opening that dialogue and having that conversation. And I just really appreciated his take on that it shouldn't just be for you to go in there and get told all the things that you did wrong. It really should just be more of an open dialogue between both, so that you can highlight some of their strengths and weaknesses, but also some ideas of things that could make the practice better for everybody. So just wanted to add in my 2 cents there because I
Yeah,
feel
no,
pretty
that's
strongly
wonderful.
about the performance review process, trying to make them
Yeah.
better.
Someone told me once nothing should be a shock, right? Like a good performance review
That's a
shouldn't be a
good one.
shock to either party. We should be having open lines of communication.
I really
Yeah, so
like
I'm
that.
sorry that you also, I mean, I have fallen into that too with past poorly performed performance reviews where there's a little bit of dread. Um, but yeah, hopefully moving forward, we're making improvements so that everyone can benefit the most from those, the business and the employee, right?
Right. Yep.
Yeah, so we had a leadership talk by Melissa Malden that focused on um, how we can help leaders build a better team towards maximizing medical and financial outcomes. So that really involved, or her focus of that webinar really involved creating an engaged team building individualized trust between team members and obviously leadership with meaningful conversations, adapting your leadership style to fit your team. So, really learning how to be an effective leader and a dynamic leader, um, because we know it's not a one size fits all. And so, there were a lot of helpful take home tips if you are in a leadership role, but even if you're not in a leadership role, learning how you can navigate how your leader leads and how to approach them were key takeaways from her presentation. So those would be, I think, what I'd highlight from our last quarter, of course. So again, switching gears to some of our other categories, I know that if you're working in the ER like Dr. Kaplan, you see a lot of coughing cats. And from clinical signs, it can be hard to determine why they're coughing. Is it cardiovascular in origin or primary lung disease? And so we had a really interesting webinar with Dr. James Barr, a criticalist, and Nancy Love, a radiologist, who teamed up. And it was so interesting to hear, excuse me, the criticalist standpoint and then the radiographic interpretation and how they would manage a case. So you want to highlight what the key takeaways from that were for you?
Yeah, sure. Yep. So this was a March 19th, 2025 webinar. It was called The Coughing Cat. Is it the heart or the lungs? And like Amanda said, it involved both a criticalist and a radiologist, which I mean, if I could have a radiologist in my back pocket, that would be amazing. I think that they can really help to strengthen our job in critical care. And we could be so much more efficient if we had one. But yeah, no, it was really cool seeing that duo together. And so with the coughing cat, I mean, our two biggest differentials are going to be, is it congestive heart failure or is it asthma? There's other things it could be, but those are pretty much the two primary ones that when we see a cat come in that's open mouth breathing, oh gosh, that's what we're thinking of. Are we going to give it some albuterol or do we need to give it some Lasix? So one of the things they stressed is to really just first reduce the stress in that cat. You don't want to take that open mouth breathing cat and rush it to radiology to get that x-ray because that stress alone might be the tipping of the scales for that cat. So stabilizing them first with oxygen therapy is always warranted. And you can also give them, some bronchodilators before jumping into imaging just to have something on board if you do suspect it's more likely asthma. And usually giving, a shot of Lasix is not going to be harmful. I can't say that with all situations, but those are some of the things we do. And then Dr. Love also just wanted to kind of highlight that if you're seeing that unstructured interstitial pattern, it doesn't always mean that it's a normal cat. It could be that there is some fluid or some fibrosis of the lungs. And if you see an alveolar pattern in the right middle lung lobe, it could actually be due to atelectasis in a cat with chronic lower respiratory disease. And so when we think right middle lung lobe, especially in dogs, we're always thinking, oh, that's like the aspiration pneumonia lung lobe that gets affected. But might not be the case in cats. This could actually represent a more chronic process, the chronic lower respiratory disease.
And you
And so,
highlighted, sorry to
no,
interrupt,
go
but this
ahead.
really gets me excited about involving the whole veterinary care team. And open mouth breathing in cats is a tall tale sign that that cat is in a state of distress and needs to be seen immediately. And so we can always empower our client service representatives, the first eyeballs on the patient when they come in, right, to recognize that sign and get the appropriate medical personnel involved as quickly as possible. So shout out to them and learning those signs as a state of an
Absolutely.
emergency. Yeah, sorry,
Yeah,
I'll hand it back. Hand it
no,
back.
that's great. Yep. So along the same lines, talking another cat lecture here, we're heavy on cats this time around, which is great. So in March, there was a YouTube live that we had on maintaining appetite in chronic kidney disease, or sorry, maintaining appetite in chronic kidney cats by Dr. Heather Kavitko-White. She's a boarded internal medicine specialist. And one of the things that I really liked about this YouTube live was she highlighted that the oral phosphate binders that we use in renal disease, they're oftentimes underutilized in feline chronic kidney disease. And really, I have this question a lot from my own staff is, should we just be giving it to cats that aren't eating? And actually, this drug is not going to work unless the cat is eating, because the way that the oral phosphate binders work is they reduce the excuse me, they reduce the phosphorus absorption from the food in the gut. So it's not that it's working to kind of pull phosphorus out of the system, it's preventing it from getting absorbed out of the food. So that's why these oral phosphate binders really should be given with the meal. And if they're not eating, they don't need to be given at that time. But they are really effective. So it is still good to try to use those. And now switching up a little bit, we're going to head into small animal neurology. We had in April a small animal webinar on inflammatory disease of the nervous system by Dr. Missy Carpentier Anderson. She's a boarded neurologist. And so this one, I see a lot of meningitis and encephalitis in the ER. And so while I see it in all sizes of dogs, Dr. Carpentier, she was stressing just how common the disease is in small dogs. And she even said, and I love this, if the dog looks good in a purse, inflammatory disease of the nervous system needs to be on your list of differentials. I just thought that was such a great way of kind of nailing home that point. And along the line of small dogs, now when we think back dogs, I think we pretty much all picture a dachshund, right? They're like the poster child for disc disease. But every once in a great while, I can get a dachshund where I can't localize the pain along the spinal cord to figure out which segment has been affected, which disc is being affected. And so, obviously I refer everything to neurology that I can, but Dr. Carpentier, she offered up that if you can't seem to localize the pain in a down dog, it might not actually be disc disease. It could be a pure myelitis, which is inflammation of the spinal cord, without inflammation of the meninges, which would add that incredible pain portion. So if you have a non-painful paretic patient, think about the spinal cord too, not just the discs. And Amanda, I'm going to hand it over to you once more to share on our last webinar highlight for this episode.
Yeah, and before I do, I just want to give a huge shout out to Dr. Carpentier. She's a regular blog contributor for us, and we have some outstanding blogs coming. Of course, she's also contributed blogs in the past, and they're really clinically tailored to pearls for veterinarians to improve the work they can do in working these patients up. Very stepwise guide. So they're outstanding, and I definitely think you should
Totally
take a
agree.
look.
Very clinically practical approach to figuring out what that neurologic
Yeah.
presentation is in front of you. They're wonderful.
Yeah, so navigate to our website, drop her name in the search bar, and it should pull up all of her content. Encourage you all to take a look there. But to talk about one of our last highlights for this VETflix series, I really liked Debbie Martin's webinar. It was in April of 2025, and it was about learning to listen to our patients. And this webinar really stressed the importance of knowing and be able to recognize patient behavior. Some call it intuition, but being able to minimize and avoid potential triggers for that specific patient that would cause them stress, and then proactively provide pleasant interactions. Those not only help our veterinary patients develop positive associations with coming to the vet clinic, so that vet hospital experience, but it's also a great way to build the practice and build morale along your, with your personnel. It helps reduce personal injury, and of course, it increases client satisfaction. So it's really a medical and business win. She does a great job of just highlighting those elements. I think the takeaway clinical pearl from that webinar would be to treat every interaction with your patient as a dialogue. So you recognize and you read your patient's body language. And that might even involve having a conversation with the client before that pet's even left their home. So that's really the clear clinical pearl takeaway from that webinar.
Yeah, I'm just going to add in there. I
Yeah,
really liked how she had said that she'd been talking about the triggers of animals, like the things that they're seeing, hearing, smelling that could set them up for a hyper excitable, I'm really nervous, anxious interaction as soon as they walk through the vet into the vet hospital. And she just mentioned, that can even start in the parking lot. Like there could be a car that goes by that they don't like the sight of, or a dog walking by, and then boom, that animal is already stimulated, hyper excited, maybe anxious and nervous, and then they go into the vet hospital and greet the staff. So it was just really great to think about all those things that could be happening to that patient before it gets to you, and to help you understand that the personality in front of you right then and there might have actually started from something else that had happened in their day. I really appreciated that take on this.
Yeah, it was a really helpful raising awareness webinar,
Mhm.
right? Self-awareness and awareness of our patients and their situation. But don't worry, if you missed any of these webinars, Elite members have access to view them in our on-demand library at any time. Of course, they can earn race-approved CE following a short quiz completion. But Dr. Kaplan, what do I do if I'm not an Elite member?
That's a great question, Amanda. Well, everybody can always take advantage of our unique 14-day, no commitment, free Elite VETgirl trial, which gives you access to explore all of the content and material on our VETgirl website.
Yeah, sounds like a great option. So I hope everybody gives it a go if they're not an Elite member already. And then you can catch up on anything you might have missed. Again, we didn't cover everything that we did in the last few months, so check us out on vetgirlontherun.com.
And until our next quarterly VETflix and Skillz episode, we hope you found these key takeaways helpful, and we look forward to seeing you at the next VETgirl event.